Here's your host for this morning's edition of America's Fabric.
Good morning. I'm Dr. Elizabeth Lee Valete. I'm an independent physician in private practice in Tucson and Dallas, and the author of several health books for consumers. My medical website is www.herplace.com. In recent shows, I've talked about several critical issues that affect your medical freedom that is guaranteed under our Constitution and Declaration of Independence. I've discussed the health insurance exchanges that require you to exchange your liberty for more government control of your medical care options. I've talked about the enrollee hold harmless clauses in health insurance contracts that prevent you from paying cash for medical care you may need to save your life. I've talked about the tactics of hospital administrators to force independent doctors off of medical staffs and out of practice so that they only keep doctors who follow government guidelines and facilitate the reductions in cost by cutting medical services you may need. And I've talked about the Fifth Amendment violation by the federal government taking your medical records without your consent or without compensation to you in order to use your medical information to serve the collective or public good and possibly deprive you of treatment you need to save your life. All of these provisions of the 2010 healthcare law conflict with our freedom under the Constitution to be able to use our property, in this case our money, in the way we choose to preserve our own life and liberty. Today I'll be discussing how the 2010 healthcare law specifically requires massive cuts in medical care for older people. This hits women particularly hard since we have more elderly and senior women in America. This is based upon the concepts outlined in Ezekiel Emanuel's Complete Lives System, which was published in The Lancet, a British medical journal, in 2009. Emanuel outlines his belief that medical procedures and resources should be concentrated on people between ages 15 and 55. Why is that? He believes that these are the productive people who will do the most to serve the public or collective good, and therefore they are the ones who deserve the medical care, given that he feels medical care resources are scarce. And he goes on to say that wasting medical care treatment on older people just costs the government money. But older people are retired and don't pay taxes anymore, so they're not productive workers and not much value to the collective good of society. Emanuel also believes that the oath of Hippocrates' emphasis on the individual patient is outdated and should be replaced with doctors being taught to serve the collective good. Emanuel served as senior White House health policy advisor during the formation of the 2010 healthcare law and is the brother of Rahm Emanuel. His views run throughout the new healthcare law, but are in stark opposition to the beliefs of the founders' vision for America and for our liberty. Emanuel's views and the historical diverging philosophies that underlie his beliefs today are eloquently explained in a new movie called The Determinators, based on the book The Battle for America's Soul by C.L. Gray, M.D. The movie features leading experts in the field of healthcare who have studied the new law. The Determinators is a chilling but true story that explains and sheds light on the dark underside of the massive healthcare reform bill that, once it is fully implemented in 2014, will significantly threaten the way Americans live and how we die. You need to know how this affects your personal life, so I urge you to watch the movie. It is available on YouTube or will be on our website, www.patientpoweramerica.com. Let's look at some of the specifics that illustrate the cutbacks in medical care and the problems you face. The new health care law cuts $716 billion from medical services for Medicare seniors, the majority of whom are women. Cuts come in the form of reduced payments to doctors and hospitals that provide medical care. For women and men, this means loss of life-saving medical services for older people. In the case of women, older women's medical services are having the money redistributed so that younger women can use other people's tax money to prevent pregnancy. Another example of the new rules under the 2010 health care law, these rules took effect on October 1, 2012, and they state that hospitals will now be paid more to do less of certain types of surgeries, such as knee, shoulder, and hip replacements, and back surgeries, all of which affect older patients. While it's true that Medicare is not allowed to cut benefits or overtly ration care, the tools that are being used to cut Medicare under the 2010 health care law is to reduce the amount that Medicare pays doctors, hospitals, pharmacies, and others who provide the medical services. So let's look at that. If these are cut, if the services are cut, can you still have the medical care you may need? Of course not. Coverage under Medicare does not mean getting the actual medical care itself if doctors, hospitals, and pharmacies and other health professionals go out of business. Coverage also does not mean medical care if doctors and hospitals are cutting back surgery to make more money or end up going out of business because they cannot meet the heavy regulatory burden now being imposed on medical practices, hospitals, and other health professionals. All of these cuts in payments to the people and facilities that provide your care mean less medical care and more suffering for older patients, suffering that could be prevented by treating debilitating conditions such as arthritis, osteoporosis, back pain, cancers, incontinence, and dementia. Recently, we have seen one political party and feminist groups obsessively focused on, quote, women's health, end quote, and, quote, women's rights, end quote, as a single issue of contraception, with efforts to compel other taxpayers, including those with moral objections, to pay for these women's health birth control services for younger women based on the myth that women need assistance from big government's big daddy to protect them from pregnancy. Compelling American citizens to use their own money to pay for medical treatment for others, especially when it conflicts with one's religious beliefs, is another example of how diametrically opposed these ideologies are to our founders' vision for freedom in America. Feminists and progressives seem totally unconcerned that paying for abortions and free contraceptives for young single women comes at the expense of medical care services needed by older women and men on Medicare. I am an independent physician and have been a specialist in these areas of healthcare for 27 years. For my whole career, birth control pills and contraceptive methods have been available free to low-income women at public health clinics. Today, contraceptives are available at regular drugstores, often costing no more than $4 a month for reliable generics, or they are covered by 9 out of 10 health insurance plans. There is not now, nor has there been at any time during my career, a problem of access to contraceptives at minimal or no cost for women of all ages and all income levels. So if access to contraception is a phony women's health issue, what are the real threats to women's health, quality of life, and longevity? Heart disease kills 500,000 women every year. Diabetes kills 90,000 women each year. Breast cancer kills 46,000 women every year, yet government experts push to reduce mammogram screenings in higher-risk women between 40 and 50. There have been an excess of 50,000 women a year with hip or spine fractures every year since 2002, when the NIH press conference exaggerated the risk of hormone therapy, leading women to abruptly stop a therapy that is the gold standard for preventing osteoporosis. Today, less than 15% of U.S. women are getting hormone therapy to reduce all of these disease risks. It is far more costly to treat a hip or spine fracture than for women to take generic estradiol that may only cost $4 a month at Target or Walmart. Seniors with osteoporotic fractures, and that includes men, suffer pain, disability, and premature death. After a hip fracture, 20% of patients die within 3 months due to complications. The taxpayer-funded NIH Women's Health Initiative study has been shown to be wrong and the risk of hormone therapy greatly exaggerated, depriving most women of the low-cost health benefits of hormone therapy that could reduce the risk of heart disease, bone loss, diabetes, colon cancer, and even dementia if hormones are started close to menopause. But the NIH has never held a follow-up press conference to correct the government's misinformation given in 2002, or to announce our newer research confirmation of the hormone therapy benefits. Dr. Philip Sorrell, founder of the Yale Menopause Clinic, has calculated that more than 60,000 women died prematurely between 2002 and 2012 because of wrong information from our federal government exaggerating the risk of hormone therapy for menopausal women. The rights that women are concerned about aren't just reproductive rights and contraceptive rights. They are the same rights that men have also been concerned about losing in the name of health care reform. The right to choose our physicians and health professionals, free of third-party insurance or government interference. The right to work with our physicians to decide what treatment is best for us without oversight and control from faceless bureaucrats who have never examined us, do not know or care about our medical history or our individual needs, and basically see us as a unit, not a patient, a dollar sign, not a human being. The right to our medical privacy and not having our medical records forced to go into the federal government's database. The right to appeal decisions made by others about our medical care. The right to use our own money for independent second opinions when care is denied by a third party or government-controlled medical delivery system. I have treated thousands of women from all parts of the country and all income levels. I know what women see as their needs and concerns for their health and that of their families. Women make up half the population, but they make 90% of the decisions about medical care for their children, husbands, and aging parents. The real women's health issue is that under the 2010 healthcare law, women are losing their freedom to choose their doctors, choose their treatment, and even losing the right to pay cash for the medical care they, their husbands, their families, their parents may need. Michelle Malkin recently had a clear statement to women voters this year. Vote with your lady smarts, not your lady parts. Women's health is clearly far more than contraception. The rationing has begun. One woman told me that her 2 kinds of eye drops are no longer available. Thus begins the Obamacare cutbacks on medications. Women are telling me that their doctors now say, "Oh, you don't need that hip replacement surgery. The rehabilitation is so difficult. We think you'd be better off just taking pain medications." And then there's the publicized case of Barbara Wagner, diagnosed with lung cancer in Oregon in 2008. Her doctor prescribed a drug that could help treat her cancer and prolong her life, but it cost $4,000 a month. The Oregon Health Plan refused to pay for it and would only approve a cheaper medication to provide comfort care for dying, rather than pay for her chemotherapy to help her live. She died a few months later. Patients are telling me that their doctors do nothing now except type into a computer at their appointments. They don't look at me anymore, they say. This is another Obamacare requirement that doctors only use electronic medical records. It isn't something most doctors like or want. And those short medical visits, 15 minutes, and if you need another question answered or another issue addressed, you have to make another appointment. The reality is, don't get upset with your doctor. That is Medicare regulations, that Medicare can only be billed for 1 diagnosis per office visit. Isn't it time to feel angry at the government rules and regulations that hurt patients? Along with the war on women's health, there are the current failed economic policies that are costing entrepreneurs, their businesses, employees their jobs, and seniors their savings. Patient Power America and the Association of American Physicians and Surgeons stand for healthcare reform based on the private sector with a focus on individual life and the individual patient-physician relationship. This is the founding principle of America that we know and love. This is changing drastically, transformationally, in ways we do not understand. For example, the Independent Payment Advisory Board set up in the 2010 healthcare law has the explicit purpose of reducing the growth in Medicare spending. The Independent Payment Advisory Board is an unelected, unaccountable board making life and death decisions about what services will be approved. It actually prevents active practicing physicians from sitting on this panel. The Independent Payment Advisory Board, if there are any physicians, we're likely to get mostly lawyers, uses policy and administrative doctors, MDs and PhDs who've never practiced clinical medicine, who don't have the same commitment to human beings and individual patients. They are number crunchers. and their recommendations become law. That is unlike most advisory boards that only advise Congress. The Independent Payment Advisory Board recommendations become law unless they are overridden by Congress, and Congress must pass comparable cuts in spending of greater or equal value, or the IPAB recommendations are actually law. And this is so different from everything that we have stood for in America. In addition, if you turn to Section 10320 of the Health Care Law, this is the expanded IPAB. It can use health care to control and regulate every aspect of our life, just like the Fed controls every aspect of monetary policy. Under the auspices of the new health care law, the expanded Independent Payment Advisory Board is authorized to use health care to control and regulate everything: what you eat, what car you drive, what guns are allowed, just to name a few. It concentrates and centralizes power in Washington in ways that are the very opposite of the oppression our founders sought to escape under the King of England. America is being changed in ways we do not understand or recognize. America was founded on the concept of sovereignty of individual and limited power of government. But for the first time in our history, we the people fear our government. I became a physician because I wanted to care for patients. I have always answered solely to my patients and to my medical judgment and to my conscience. People who are sick are vulnerable, and the personal relationship is key. But I am seeing a fundamental and ominous transformation of the doctor-patient relationship as Washington imposes itself on every patient decision that we physicians can make. Beneath the debate on health care lie two fundamental conflicting views in the battle for control of America. One is, do we, the people, still accept the fundamental premise in our Declaration of Independence that we are endowed by our Creator with certain unalienable rights, and that we believe in a higher moral code that restricts physicians and, politicians from centralizing all power in the hands of a few? Or do we believe that rights come from the government? This view is really out of sync with our entire political system, our historical values, and our culture. Most Americans have always believed that individual liberty and individual initiative and effort and entrepreneurship are what have made us great, that the government cannot and should not do it all, and that socialism doesn't work. As I have said before, we are at a critical fork in the road for our survival as the greatest beacon for human freedom that has ever existed. What future do we want for American healthcare, for America as a whole? Ultimately, this is a battle for power. It is crucial that American people take back their power. You decide on November 6 which you prefer. This is Dr. Valit signing off for today. I urge you to fight for liberty and the values of our founders that have woven America's fabric.
You've been listening to America's Fabric, a radio series on American history and culture, broadcast every Sunday over KVOI Tucson and its affiliates. Be sure to tune in again next Sunday morning at 8. Until then, never forget, it's the courage, knowledge, hard work, and respect for truth of Americans that keeps America free and prosperous. America's Fabric is listener supported. To make a contribution, send a check to America's Fabric, Post Office Box 17356, Tucson, Arizona 85731. That's P.O. Box 17356, Tucson 85731. All contributions are tax exempt, and every contributor will be mailed a Grateful to Be an American bumper sticker. To get more information on America's Fabric or to listen to previous broadcasts, go to americasfabric.com. That's americasfabric.com.